Hello. Today we're going to focus our education on coronary artery disease risk factors. And today we'll just do a general overview of all of our cardiac or coronary artery disease risk factors. And then in the upcoming weeks, our staff is going to provide you with more information on most of these risk factors. So we will go more in depth. This will just be kind of a broad overview so you can kind of get a sense of how many and what are your risk factors for heart disease. So we're going to go ahead and start off with the 3 risk factors that we can't change. We can't do a lot about these ones, so we're not going to focus on them. We're not going to dwell on these ones, but one of those is our genetics, right? Whether maybe mom or dad passed down the high cholesterol producing gene, we all might have certain things where we're more prone to genetically. And so that can be possibly your situation or part of your situation. And so that's not necessarily something we can change within our lifestyle. But what we can do is, it's good to know that that's a risk factor for us so that we can be more aggressive with your other risk factors that we can potentially change. And then another one that I'm thinking of that you can't change is our age. So once we are at the age of 40 or higher, we are automatically at increased risk for heart disease or coronary artery disease. And then that third one that we can't do as much about is gender, and whether we are male versus female. Heart disease, like other things, it impacts males and females differently. So heart disease is one of those examples. And with women, generally estrogen is kind of protective earlier on in our lives, and then when we hit menopause, those estrogen levels drop, and so that increases our risk for heart disease. Women tend to have worse outcomes of heart disease, and that is partly because we a lot of times can get symptoms that aren't as easy to recognize as having a heart problem. We tend to not get evaluated soon enough, or maybe get misdiagnosed that we're having heart problems. But that can be one of the reasons that women have worse outcomes. And they do a lot of education in February to get out the word that sometimes women's symptoms can be more atypical. We might feel, excessively fatigued or more flu-like symptoms, that we are starting to have a problem with heart disease. So that's where it's good to be going to those regular primary care doctor appointments and communicating well with your doctor to be a good advocate for your health. So we will provide more information specifically on that. But those are the 3 risk factors that we can't necessarily change. So we're going to primarily focus on these risk factors that we can really make an impact on. That's one of the good things about coronary artery disease risk factors, is that we can a lot of times make a big impact through our lifestyle, and primarily through good nutrition and regular exercise. So we're big promoters in cardiac rehab of exercising regularly and eating healthy foods. So the first one we're going to cover as a risk factor for coronary artery disease that we can make some changes to through our lifestyle is smoking. And smoking is kind of that number 1 risk factor that we can change to decrease that risk of serious illness. Smoking can cause our arteries to spasm. It makes our heart demand more oxygen. It can also, with those chemicals, damage our arteries. And so that damage to the arteries is something we're going to kind of commonly be coming back to with the theme for cardiac or coronary artery disease. Is we want to take good care of the inner lining of our blood vessels. If those become damaged, we say they get little nicks and dings in the inner lining of those coronary arteries, and our body wants to lay down plaque or cholesterol, kind of like a Band-Aid, and smooth over that area of damage. So the more damage that we're doing, the more nicks and dings that we're creating, and the more cholesterol our body is producing, it tends to accelerate that process of plaque building up or atherosclerosis of those coronary arteries. It starts to narrow those coronary arteries. So we will talk more about that in future education topics. But that's one of the things that smoking can accelerate, is the damage to the inner lining of those blood vessels. They say that chewing tobacco can be potentially even worse because it can go directly into the bloodstream. So smoking is, there's not really a gray area of recommendation. It's either you do it or don't, and the recommendation is to quit. So we do have resources that we will connect you with if that is something that you have a goal of doing. So reach out to staff if you want more information on smoking cessation. And the next coronary artery disease risk factor that we're going to cover is cholesterol. We will talk more in the nutrition series of education, or just cardiac series of education, I guess, on cholesterol. But it is important to be going to those regular doctor's appointments. Again, being a good advocate for yourself. They tend to usually check that at least once a year, maybe more often at your primary care doctor office, if that is, has been a risk factor for you that they're more closely watching, but generally at least once a year. And they will do what's called a blood lipid panel. Well, they'll do a blood draw and give you your results back for your lipid panel. And if we have seen what your recent lipid panel numbers are, we have, carried that over into the chart that you have access to in class, because we would like to, talk to you about if you have questions on your specific lipid panel. So feel free to ask staff about your specific numbers. We will go more into this, but generally we want our total cholesterol less than 200. We want our HDL, which is the good cholesterol. So you can remember that with H as being, you want it high, H for happy, or H for heavenly. You want that HDL number higher. And it's a little different between men and women. Men usually want that HDL over 40. Women usually want that number over 50. And that's protective. It kind of acts like a plow and plows plaque out of the blood vessels and takes it back to your liver for your body to get rid of it. So we want high HDL numbers. Our LDL is our low density lipoprotein. And those numbers we want lower, generally less than 100, unless you have 2 or more risk factors for coronary artery disease, which many of us in these classes have. Then your cardiologist may have given you a more specific recommendation to get yours even lower, potentially less than 70 would be the recommendation for your LDL. And that is the lipoprotein that deposits plaque in the blood vessels and starts that buildup process in the artery. So that's why we want low LDL numbers. And then you'll also have your triglyceride numbers. And we generally on your lipid panel want that number less than 150. And we will be talking more about triglycerides in an upcoming education topic. So know your numbers is kind of the recommendation with the cholesterol. Be tracking that so that you can have good conversations with your doctor about where your numbers are and where the trends are for those numbers. And then the next coronary artery disease risk factor that we'll cover today is blood pressure. And this is another one that will take more education time to discuss. But blood pressure is something you get very familiar with in cardiac rehab, where we're checking those numbers regularly. And we generally want your resting blood pressure numbers less than 120 over less than 80. And the reason for that is we want to make sure our blood pressure numbers are not chronically high. If your blood pressure is chronically high, then your heart's having to work harder to push blood out to the system. It's more force or more pressure against those arteries. And again, we want to have the blood pressure well controlled so that we're not putting more stress on the inner lining of our blood vessels like we talked about. We want to minimize that damage or minimize the nicks and dings. So you can kind of think about that one as like a garden hose example. If you have a garden hose that's kind of at a moderate trickle versus a garden hose that's on, full force, over the course of years, that garden hose that was turned back a little bit, moderate trickle, that garden hose is probably going to last a little bit longer. Kind of similar to our coronary arteries. We want to well manage our blood pressure numbers. So we will talk more about that coming up. And like I've said with a lot of these, the good thing is that we can really impact our blood pressure and all of these through healthy lifestyle changes. So we're going to be talking a lot about watching sodium in the diet. We're going to be talking about exercising regularly, because all of those things can impact our blood pressure numbers. And then moving on to diabetes. So diabetes is, a risk factor for heart disease or coronary artery disease if it's not well managed. So if you are diabetic, you want to be checking your blood sugar regularly, making sure those numbers are well controlled, working with your doctor who manages your diabetes to make sure those medications are in the right range that are helping keeping those blood sugar numbers controlled. Exercise and nutrition is also a big part in managing those blood glucose numbers. And we have staff available that can help you if you have questions on your blood sugar numbers if you are diabetic. So more to come on that. Feel free to reach out if you have questions. But if those blood sugar numbers are not well controlled, if they're chronically high, that's another thing that can damage the inner lining of those blood vessels. So we want well-controlled blood glucose numbers. And then next one here is weight and waist size. We will be talking about this coming up also as far as weight management education. They have found that there are big improvements with our overall health if we make even smaller reductions, like 5 to 10% in our overall body weight. That can lead to really big health improvements. So we want to establish and set those weight management goals if our body weight is over that recommended number. And part of the way that they can give you that recommendation is by using waist circumference. So if you were to measure a circumference measurement an inch above your belly button, generally they want women to be under 35 inches in diameter, or in circumference, I guess. Men should be less than 40 inches. And if you're above those ranges, then you'd want to start setting those weight management goals. For a time period, we're using body mass index or BMI to give those recommendations. A lot of times now they'll say that's better for like population averages or population information, but specific like individual recommendation, using that waist circumference measurement can be more beneficial. And then, genetically, some of us are more prone to storing fat in certain areas. And so generally they recommend that if you store more fat around that abdominal region where it's closer to those internal organs, that's generally a less healthy area to store fat, versus at like the thighs or, the midsection there, that the thigh area is generally considered a little bit healthier area than the abdominal fat. All right, so moving on to physical activity. So exercise is a really important component of our overall health. And if we're not getting enough of it, that is considered a risk factor for coronary artery disease. They generally recommend that we get at least 30 minutes of cardiovascular exercise at least 5 days a week. And so another way to think about that recommendation is if we get at least 150 minutes a week of cardiovascular or aerobic exercise, that's that minimum guideline or minimum goal for heart health. If we're not getting that goal, that would be considered a risk factor against us. So we will talk more about your home exercise program coming up and those recommendations for the home exercise. What you're doing in cardiac rehab is an awesome start to that, whether you're coming 2 days a week or 3 days a week, but we generally want to start adding some of that in on some off days once you're feeling comfortable and ready, so that we're getting closer to meeting those guidelines. Let's see. And then lastly, we want to touch on contributing risk factors. So these aren't necessarily considered full, coronary artery disease risk factors, but they are what we consider contributing risk factors. So with those, we want to discuss stress and strong emotions. We feel like looking at and discussing our emotional health is just as important as the physical health. They both really impact one another, so we want to be addressing both. And we will talk about stress and depression for education topics. So there will be more to come on this one. But when we are stressed, it's that fight or flight response. So heart rate revs up, blood pressure revs up. We're kind of in this revved up state. And so if we are feeling that way chronically, where we have a lot of stressors in our lives, then that gets to be more wear and tear on the body and on the heart. So we want to be looking at our triggers. What are our stress triggers, and then how do we best de-stress? We're all a little bit different there. So how do we take de-stress? So we will talk more about that. One of the other contributing risk factors is excessive alcohol consumption. And the recommendations for that are that men should drink no more than 2 drinks a day. Women should drink no more than 1 drink a day. And 1 drink is equal to a 12-ounce beer, 4 ounces of wine, or 1 ounce of 80 to 100 proof liquor. So that would be the recommendation for that if you do choose to drink, to make sure it's not in excess. And then the other contributing risk factor is lack of or poor sleep habits, where generally they recommend adults get 7 to 9 hours of uninterrupted sleep. I know that's difficult to meet that recommendation, for myself included. So just doing the best we can to maybe reduce caffeine after a certain point in the day, make sure that we are avoiding maybe screen time later in the evening, or stressful news, or whatever that might be, kind of finding those ways that you sleep best, because that is an important part of the healing process and our overall health, to make sure we're getting good quality sleep. And then the last coronary artery disease risk factor that's a contributing factor that we're going to touch on today is oral health, or oral hygiene. And the recommendation for that is to brush at least those 2 times a day, flossing daily, and make sure we're replacing our toothbrush every 3 to 4 months, and getting regular dental checkups and cleaning. When we have poor oral hygiene, we have higher levels of inflammation in the gums and in the body. And so inflammation is something that we will also touch on, that we want to make sure we are controlling and reducing inflammatory levels in the body. Our staff has really good handouts on a lot of these risk factors. So reach out after class if you would like some additional risk factor information and handouts. And we will also be touching on a lot of these for more in-depth information. Thank you.